Hi, I'm Benjamin Hill with Mission Physical Therapy. A lot of my patients or people that I meet in general, when they find out I'm a physical therapist, they ask, what can physical therapy do for arthritis? I see the reason for this question, especially if you get on the internet and you talk to Dr. Google, you'll find out that there isn't any cure for arthritis, any known cure. A lot of research is being made in this area with stem cells and things like that. But in the meantime, you might have a little bit more hope if you were to talk to a physical therapist and find out. Though there's no cure for arthritis, it's a little bit of a misnomer. Arthra means joint, itis means inflamed. Say your knee hurts, and a doctor takes an x-ray of your knee and looks at that and says you have arthritis. What he's saying is true, but you can't really see inflammation on an x-ray. So it might be a little bit better to use the term degeneration. He's seeing some degeneration in your knee. And that's why he says you have arthritis. Whether or not that's inflamed is the key thing. So if you're in pain, obviously it's inflamed. So there's this active, inflamed, painful arthritis. And then there's the type of arthritis that doctors sometimes point out on x-ray. Someone's getting an x-ray because they've got pneumonia, let's say. And then the doctor points out, hey, look at this, you've got some arthritis in your back. Well, I don't hurt there. Well, that's because it's not an active, inflamed arthritis. So can physical therapy help somebody with arthritis? Certainly. The way that it helps is by improving the way you move. When you're not moving in such a way that you're loading your knee so heavily, that active inflamed arthritis becomes an inactive arthritis, where it's not inflamed and painful. And for some people, that's relatively easy to do. You do something with different interventions to break the cycle of that inflammatory process, but then you most certainly have to do something to correct the way that person moves. Some posture training, gait training, functional or body mechanics training, and you teach that person how to offload their knee and maybe use their hips more, for example. And this applies head to toe, whether the arthritis is in your neck, your back, your shoulder, your knee, your foot. It can be improved by learning better body mechanics and receiving some treatment from a physical therapist. I'm Benjamin Hill with Mission Physical Therapy.